Hi, I'm Val, and I'm a second-year children's nursing student at the University of Brighton. I chose to study at Brighton as I've lived here since moving from the Philippines, but my mum was actually a student nurse here herself, having finished just as I started. The support here is valuable to my professional development as a nurse. The University of Brighton, in addition to my academic development, has also helped me to learn more about myself and my own personal development, which is integral to the way I will approach my work in the future. The range of placements is great. There is also a dedicated children's hospital here in Brighton, with such supportive staff who provide us with opportunities to learn. Within my cohort, I've formed incredibly strong friendships with amazing individuals who have the same goals as me. We encourage and support each other, and it's highly motivating to be with them during the uni week. Outside of studying, we have a laugh every now and then, and it helps us all to relax outside of our studies. 50% of the course is spent on placement. Within the uni modules, we have a practice learning module every year. This involves keynote lectures and practical sessions to help us refine our skills and be able to use them in our practice as student nurses. A typical day differs depending on where you're allocated. My first placement was a community placement with a health visiting team. A typical day in that sector was visiting the homes of service users and assessing the development of a child aged 0 to 5 years old. My next placement was a surgical ward, where a typical day would be admitting patients, delivering post-operative care, and even getting to watch surgery. Both worlds are completely different in a lot of aspects, but both experiences are valuable in our learning and development as a healthcare professional. The support was incredible in terms of pushing my learning. Both placements were supportive to offer me experience in other related areas to further my learning. In health visiting, I was able to work with a midwife and see the patient journey of both the mother and the child, from the midwife to the health visiting team. Whilst in the surgical ward, I was able to work in the eye outpatient services to learn how patients get referred to have eye surgery. Additionally, my rota was changed so that I could see the patient journey of a child undergoing eye surgery. My favourite memory so far is where I got to witness eye surgery of a patient who was nervous and wanted someone to hold her hand. At this point, I was not as queasy as I usually was with surgery, as I wanted to focus on helping her have comfort. After her surgery, she sat immediately up to look at me, and she had the biggest smile on her face. It really was an amazing moment, and I'm so grateful to be an anchor of support for her. The teaching team are lovely, warm, and responsive. They make lectures engaging, and they really give their all in ensuring that we learn contemporary content that will help us in our professional development into nursing. They have supported me with queries regarding my assessments and helping us refine our academic and practical skills, such as potential topics to write about in assessments or in assisting us with clinical technique. They are very knowledgeable in signposting us to useful resources to further strengthen our learning. They are very approachable and patient and adaptable with our queries. I feel listened to when I speak to them, and they motivate me to go into my lectures. The campus has facilities for students to practice clinical skills. An example of recent ones I did was practicing passing a nasogastric tube and intubation. We use these facilities almost every week. They include a hospital ward and a simulated home environment. Our lecturers help us by going through the theory behind the clinical skill. For example, the anatomy of the respiratory system of an infant and a child when discussing intubation. We are set pre-learning that can help us with our theory beforehand too. We also have the skill zone where we can practice our skills independently outside of teaching times.